Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
It is that time again as we discuss a new concept, not necessarily a new concept, but a new way to deliver healthcare here in Austin. And we are once again joined by Lee Acey and Dr. Dave Strobel to talk about the Help Care Clinic. Gentlemen, good morning.
Yeah, thanks, John. Great to be with you.
Good morning, John.
And, boy, you've been rolling right along. I know we've been going through this sort of membership period where folks can sign up for the Healthcare Clinic at a discounted amount, and not that it's going to be overly expensive when that discount expires. Where are we at on membership right now? How's it going?
Well, we had originally set a goal that we wanted to have 300 members as our founding members by April 2nd. And as it turned out, we ended with 323 during that period. So it was we were super excited about the response, and we had 10 or 12 people a day signing up there, toward the end as that deadline was coming. And now we're into the early bird phase because so we're still the rates are a little bit higher than they were, but they're now $119 a month for a single, $199 a month for a couple, or $279 a month for a family. And those are still 20% below what the regular rates will be once we're fully up to speed, once we're 5 days a week, once we have the dispensary, together. But it is, so it's still a great opportunity for people to get in very much as early adopters, because, there's, we've only been in operation for a couple months now. So it's, but yeah, we had a great early response and even beyond what we had expected or hoped for.
Which is really fantastic. And I suppose if someone's hearing about this for the first time, we should really kind of recap quickly just the concept, because while it may not be radically new based on history, it is something different than what people have been used to when it comes to going to see their physician or going to get some health care.
Yep. Sure. Yeah, the basic idea is it's unhurried primary care that's unhurried and based on a membership instead of on insurance. So because we don't take any insurance of whether government or private, we're able to keep the costs a lot lower because the administrative costs are lower. We don't have to be haggling with the insurance companies or the government for reimbursement. And it's just about providing a good quality care experience at a fair price. And through that membership, we're able to do that. Or actually, David, Dr. Strobel.
You're in the front office, and Dr. Dave Strobel, I was just going to ask you, too, that maybe talk to the folks that are hearing about this, about that concept. And, it's really near and dear to your heart. It's a passion to be able to kind of get back to some old-school doctrine, if you will.
Yes, indeed. And, the problem with American medicine is basically currently entirely due to the third-party payers. Now, that has a whole bunch of downstream effects that change how clinic medicine, healthcare in general, is delivered. And so when the insurance companies then underpay the providers, doctors, hospitals, lab services, x-ray services, that kind of thing, then in order to basically make ends meet, they have to dramatically increase their prices. And of course, there's some greed that's involved in that. So sometimes the prices aren't just increased to what they need to be, but they're increased above that. But that's the case in any human institution. So we can't make that go away. But that increase in price is only part of how that works, because then the other way it works is by generating volume and increasing the number of visits. And so then you just have to churn through patients as fast as you can. And meanwhile, the insurance companies are taking money from the patients or from the patient's employer. And so they're paying for service that they're not really getting in a very satisfactory way. Mm-hmm. And so the patients are unhappy, the doctors and the service providers are unhappy, and it appears that the only people that are happy with this are the insurance companies. So although insurance companies do play a really important role for when there are catastrophic costs, when they started getting into paying for what was just routine care, then they started actually controlling the system and strangling it. And so we're just about taking the insurance company's hands off the provider's neck so that they can actually sit and listen to the patient, talk to the patient, and have a more comfortable experience. I tell my patients virtually every day, the visit isn't over. We're just done for now. And so let's make sure we deal with the stuff that's most important for you today, and then we can get back together again by phone, by text message, by email, by video visit, or in person at another time. We can just keep on going.
Well, that's the other really great, that's just the other part I want to chime in about with that is the really great part about it is there isn't a charge for that next visit. Right. It's all part of the membership, and so it's all about taking what time it needs to give you the care that you need without having to worry about whether it's going to be reimbursed by the insurance companies or not.
Well, and that's kind of what I was going to chime in, saying that nowadays you go to the doctor and you may talk about a myriad of things, but you deal with the most immediate, and then you might not have another appointment for a year, and you don't get that follow-up. And that's what this is all about.
Yeah, that's exactly right.
Yeah, this is a great concept. Lee, I was going to ask, because you do the front office stuff, and you probably get a chance to meet with more of the members that are coming in and signing up. What do you hear the most of? What are people most encouraged about when they make that decision to sign up with the healthcare clinic?
Well, I think that last thing that Dr. Strobel was just talking about is just having a provider who will take time to listen to them and to see them as a whole person and not just as what their most urgent symptom is. So there are certainly times we leave enough time in the schedule for if there's somebody that has something urgent that we can get them in for a shorter visit to address that thing. So we're providing for that. But also then to be able to just say, yeah, I can dig deep and we can find underlying causes of some of the things that, you might have two different conditions that are very closely related, but if you're treating them in isolation with one pill for one and one pill for the other, it's not necessarily going to get you to the best long-term health outcomes. So that's really resonated with people as they're signing up. And we're getting a lot of people who are relatives and friends of our members. They've had an experience here with Dr. Strobel, and or they remember working with him back 20 years ago or so when he was actually wasn't that long ago. It was for about 20 years, but it was about 10 or 12 years ago that he was practicing in town. And so they're excited to have an opportunity to see him again.
And one of the things we should, again, kind of get back to is that you still have membership open, so people can still sign up, receive the discount. Kind of walk us through that real quick.
Yeah, it's our rates are when we have everything fully operational and 5 days a week, the rates are going to be $149 a month for a single, $249 for a couple, $349 for a family. We're 20% off right now between now and the 1st of June. We're going to be, while we're still ramping up, we're still working out, details, and we just did our first Wednesday appointments this week. So we're doing some Wednesdays and then Thursday, Friday, Saturday. So because it's not completely what it's going to be, it's 20% off. So it's $119 for a single, $199 for a couple, $279 for a family. So, and those discounts will continue even after that early bird. We're calling it the early bird phase. Even after that's done, those people will still continue to get that 20% discount from the full price on an ongoing basis.
Yeah, it's a good opportunity for people to really get back and take control of your health care. I would encourage everyone to stop in and visit or give you a call. How can people get a hold of you to find out more about the healthcare clinic?
They can call us at 279-2345, or they can stop in at 308 4th Avenue Northwest. It's right between the Hormel Historic Home and St. Augustine's, so it's really easy and accessible. Plenty of off-street parking, very accessible, and we encourage people to stop by and see for themselves.
All right, fantastic. Lee Acey, Dr. Dave Strobel, always a pleasure to visit with you, and I'm glad to hear that people are getting the message and they're signing up for memberships with the Healthcare Clinic. Have a great week. We'll talk to you next Thursday.
Thank you very much. Have a blessed day.
All right, thank you.